What's going on, everyone? Happy Monday. I'm kicking off the week here, trying to get a job as a registered nurse, and it seems to be one of the most popular jobs right now. So I know it's a tricky one, but I'm just going to search for a registered nurse position on LinkedIn here and dump this info into the InStage simulator, and it's going to create a mock interview for us based on that job posting. So it should give us a very good idea of what to expect in the real interview. And even though I am in no way qualified to be a registered nurse, I want to show you what to expect. And I'm going to do my best to try and answer these real nursing-based interview questions, even though, as I mentioned, I'm not qualified in any way. So if you're a registered nurse and you're watching this and you have advice, please post it in the comments so that anyone who is preparing for a nursing interview might learn some tips and tricks from you. And if you are someone who is trying to interview to become a nurse, post any questions you have in the comments, and hopefully there's someone with some experience who might be able to give you some advice. But for now, I'm going to use all the acting skills I have to try and get this job, at least get through the first round interview, and show you what it might be like. So wish me luck.
Good morning and welcome to the interview. I'm Azealia, the hiring manager for this position. Before we begin, tell me, how has your day been so far?
Hey there, Azealia. It's been a great day so far. I just got back from the gym and had some breakfast, so feeling good and excited for the interview today. How has your day been?
Well, my day has been as thrilling as watching paint dry. But I'm glad to hear that you're feeling good and excited. Now, let's get down to business. Shall we?
Sounds good to me. Hopefully we can make it more exciting with this interview.
Exciting. Well, we'll see about that. Let's start with your experience. Can you tell me about your previous experience working in the Neonatal Intensive Care Unit, NICU?
I actually have not worked in the neonatal intensive care unit before, but I'm extremely excited about the opportunity to apply some of the skills I have in that setting.
So, you don't have any experience in the NICU. That's quite a gap. Don't you think? How do you plan on applying your skills without any practical experience?
Well, I think like many positions, there's a lot of transferable skills. So I've been in many roles that require detailed oriented work ethic. And I feel like being in the NICU is a position that is going to rely on many of those skills. For instance, I used to work in a factory that developed high performance race cars. And it was extremely important to make sure that those cars were developed properly, and that specific standards were followed so that the race car drivers weren't at any additional risk while they use the cars.
So, you're saying that your experience working with high-performance race cars somehow translates to providing care in the NICU. Seems like a bit of a stretch. Don't you think?
I definitely think it's a big career change, but I'm looking to transfer from a career in engineering into healthcare. And so I do believe that I have skills that are going to be useful in this new role. Yes, it's a bit of a stretch, but I am someone who has always tried to push myself to the next level in the things I do.
Well, it's certainly a bold move to switch careers like that. So, let's talk about your motivation. What specifically draws you to working in the Neonatal Intensive Care Unit and Pediatrics Unit?
Well, I have always been someone that is interested in, actually more than interested, I've always been passionate about helping people. And I think it took going through a career in engineering to realize that working with machines, especially high performance machines, is one thing. It's very satisfying. But there was a human element missing from that career that I think I am looking for in a career in healthcare. And even just amongst my family and friends, when people are having maybe the most difficult time in their life, if they know me, they will come to me to ask for help. And I want to build on that ability to be there for people when they need it the most. So that's what has drawn me to this field specifically.
Well, it seems like you've had quite the epiphany in your career journey. So, how do you plan on transitioning from working with machines to providing care for vulnerable infants and children? Any specific steps you've taken to bridge that gap?
Yes, I've been taking online courses, doing my best to learn about the best practices and current best practices in the field. And one thing I learned from being on the job in an engineering role was that there are many things you can really only learn on the job. I did an entire degree in mechanical engineering and felt like my first day of work um, was an entirely new world. So I know there are things that I'm going to have to learn in the role, and I am quick to adapt, ask questions, and make sure that I'm doing things the way they need to be done. So I think part of that is going to come from being in the position and taking on responsibilities.
Taking online courses is a good start. But do you have any hands-on experience or practical exposure in the healthcare field? And what specific steps have you taken to gain that experience?
I grew up doing martial arts, and as a high performance athlete, I also did a lot of coaching. To be a coach, you have to take many first aid courses and coaching certification programs. And so I have been able to provide um, minor health care assistance to athletes, in the middle of fights. So if they suffer a minor injury, I've been able to apply the proper strategies to make sure that they are taken care of. I make a decision about whether they are um, able to go back into the ring or not. So I feel like I've been in a high stress environment that depends on my ability to assess someone and make sure that they are healthy. So I think that experience will translate into this role too.
So, you're saying that your experience in martial arts and coaching has given you some exposure to providing minor healthcare assistance. That's interesting. Now, let's talk about your technical skills. Can you tell me about your experience with patient and family health teaching?
Well, again, I would draw from my martial arts experience as a teacher. I also taught many students, hundreds of students over my time as an athlete. I would often have to talk to families and explain why we were doing certain things um, to help their children. So I have worked with children for the past decade, students as young as 4 years old to students well into their 80s. And I have learned that everyone needs a unique approach. And um, caretakers also need a unique approach. The approach we use to explain how to do something to a child is very different than explaining why we're doing that to their parents. And so, in a role like this, I think it's going to be important to make sure that when we explain a procedure to the child, it is at a level that makes them feel comfortable. And when we explain that same procedure to their parents, we make sure that it's at a level that makes them feel comfortable. And those are two different things, even though we might be talking about the same procedure.
So, you believe that your experience in teaching martial arts has prepared you for patient and family health teaching. Interesting perspective. Now, let's move on to a situational question. Imagine you're working in the NICU and you encounter a medical emergency. Walk me through the steps you would take to respond to the situation.
In my position, what I would do is immediately notify someone on my team. I think that's one of the most important things you can do in a situation like that, is make sure that other people are aware of it. I think being the only point of contact in that situation is dangerous because if something happens to me, now that person has no one else to respond to the situation. So the first thing I would do is make sure that I call for emergency support. And then I would assess the situation from there and figure out the steps accordingly. I would need to know a little bit more about the situation to be more specific, but that would be my general thought process: is make sure other people are aware of the situation, and then do my best to stabilize the emergency, whatever that might be.
So, you're saying that your first step would be to notify someone on the team and ensure that emergency support is called. Can you give me an example of a specific medical emergency you've encountered in the past and how you handled it?
Yes. So in a martial arts context, for instance, I've seen someone take a kick to the head and pass out. And the first thing to do there is call for a medic. It is the first step that we have always taken as coaches, is to call loudly, use any means necessary to call for immediate medical support. And then after that, it's to clear the area, make sure that no one touches an individual in that condition, because they could inadvertently make things worse. And so clear the area, make sure that that person um, isn't disturbed in any way. And in this case, the athlete came to, so I just tried to keep them calm and let them know that additional help is on the way. It wasn't my role in that situation to provide medical assistance. It was to just make them as calm as possible and wait for assistance to arrive.
So, it seems like you have experience in recognizing the need for immediate medical support and creating a safe environment. Now, let's talk about your cultural fit. How do you prioritize patient-centered care in your practice?
It would be at the forefront of my focus here, making sure that patients feel comfortable. And that's something I think I've developed in many aspects of my career. So as an athlete and a coach, it was making sure that my students felt comfortable doing the best they could at a tournament, for instance. And many of the athletes I coached were very young and were very scared to fight for the first time. And each one needed a unique approach. So I think keeping the student in that case and translating that to the patient in this case, making sure that they are top of mind, and that they are handled with their uniqueness in mind, is what's going to make all the difference in their experience.
So, you believe that individualized approaches and creating a comfortable environment are crucial in providing patient-centered care. Now, let's talk about your technical skills. Can you tell me about your familiarity with information systems and technology in a healthcare setting?
Well, I have, as I mentioned, done a degree in mechanical engineering, so I'm extremely comfortable with IT technology. I would usually be the go-to person to troubleshoot any of our systems. Uh, we were, again, primarily using mechanical engineering-based software, so 3D design software, tools of that nature to develop components. But I don't think I will have any problem adapting to a medical-based software. I think, as always with software, there's a bit of a learning curve, but I have been in an environment that constantly required me to learn about new systems, new software, and new applications. And it's something I really enjoy doing. So I have used extremely technical software in the past, and I think I would be able to adapt to medical-based software without too much difficulty.
Well, Mr. IT expert. So, besides your experience with mechanical engineering software, have you had any exposure to specific information systems or technology used in healthcare settings?
Not in a specific healthcare setting, no. I haven't had any experience with specific medical tools, but I think that if I was given the opportunity to see one of these systems, and usually they have been restricted to me, I haven't been able to get access to those. Um, if I did have access, it wouldn't take me long to understand how they work and potentially um, even how to improve them.
Oh, so you haven't had any specific experience with medical tools or systems, but you believe you could quickly understand and potentially improve them. Interesting. Now, we're nearing the end of the interview. Do you have any further questions for me?
Yeah, just one quick question. Um, Based on the other people who have had this role, um, what do you think the most difficult aspect of it was for them?
So, the most difficult aspect of this role for me, and possibly for others, is the high level of responsibility that comes with providing care for vulnerable infants and children. It requires a great deal of attention to detail, emotional resilience, and the ability to make critical decisions in high-pressure situations. Do you have any other questions?
No, that makes sense. And that is something I think I excel at. I do my best work under pressure. I know that's a bit of a cliche, but it is very true for me. And so, um, yeah, thank you for this opportunity today. And I hope to hear back about next steps soon.
Well, we'll see if your ability to excel under pressure truly shines through. Thank you for your time today, and we will be in touch regarding the next steps.
All right, everyone. Hopefully, you got a bit of an insight into what a nursing interview might be like. I did my best to draw on any experience I had to answer those questions, but again, I am not qualified to be a registered nurse. That being said, hopefully, seeing me go through that interview uh, makes you feel even more confident about going to your interview. If you have done any sort of training to be an RN, you have a better you have a better chance of getting this job than I do. And so I think one of the most important things to remember is to give yourself a chance, try. I doubt that I will get this job, but you learn so much answering these kinds of questions out loud. And I have to admit, I'm pretty happy with the way that interview went. I like reflecting on the experience I have and thinking about how it applies to other opportunities. So, if nothing else, I hope you learn something about yourself as you go through this process. And in just a second, we're going to take a look at a report here that tells me a little bit about how I did. Uh, but if you have questions, if you have comments on how I answered those interview questions, post them in the comments. Let's try and help each other out here. Uh, I think now more than ever, it is obvious we need more registered nurses. And for those of you that are RNs potentially watching this thinking, you know, I didn't answer those questions the way I should have at all, or, maybe just smiling to yourselves as you think about how you might have answered these questions. I just want to thank you for the work you do. If you are an RN and you're watching this, or if you are even someone pursuing this as a career, it is extremely admirable, the work you do. So thank you very much. All right. Now, as expected, I did not get the job, but I think that's a good thing because I should not be hired as a registered nurse. That being said, I want to point out a couple things on this report that might be helpful to someone who is qualified, but hasn't been to an interview before or has been to one and is unsure why they didn't get the job. So um, you're going to see here, it talks a bit about how I've demonstrated enthusiasm and motivation, but struggled to provide specific examples, relevant skills, and experience. This is a theme I have seen throughout kind of the interview prep world, if you will. I've heard this from countless career counselors and hiring managers. This is what gets you the job. If you can talk about a specific time you used a relevant skill, that's what connects the dots for someone hiring a new employee. How did you do something in the past? What did you learn from it? And how are you going to apply that experience uh, in this new role? So do your best. If you are going to interview for a position as an RN, to draw on your previous experience and really focus on the specific skills you used in the past, maybe how you developed them throughout the course of that previous role, and how you are going to use them in this new role. That is a trick, I think. not just talking about what you've done, but what you are going to do, how you are going to use your experience to be a contributor in this new role. That's just going to make it easier for them to recognize why you're a fit. So for anyone who is interviewing for an upcoming position, I want to wish you the best of luck. Don't worry about me. I'm going to be applying for a new job tomorrow, and hopefully we'll be able to share some more tips and tricks with people interviewing for different jobs. So good luck. If you do get the job, post in the comments so we can share you on. And again, if you're someone with experience and you know how to answer some of these difficult questions, please share your advice in the chat so that anyone with an upcoming interview can learn from you too. All right, everyone, you have a good one, and I will see you next time.